Picmonic is a quick and effective aid to help you pass your NP boards. They utilize 2-minute videos that connect difficult-to-remember facts with unforgettable characters. By tying facts together into ridiculously memorable stories, you'll be able to retain the information for test day. They help reinforce what you learn and track your progress with thousands of built-in rapid review multiple choice quizzes. The use of the intelligent space repetition algorithms automatically adjust to your learning needs, so you'll be reminded to review the right information at the right time, increasing long-term retention. Picmonic is also integrated into the True Learn question bank, so you can study exactly what you need and test your knowledge. Check them out today if you're preparing for board. Link in the show notes. Attention all nurse practitioners and NP students, are you tired of feeling the disconnect between clinical rotations and didactic teaching? Say hello to Success NP's clinical booklet guides.
As NPs ourselves, we know how valuable it is to have a resource that helps bridge the gap between clinical and class. So we created the digital resource to do just that. Our clinical booklets cover 5 major NP tracks: psych, adult, peds, family, and women's health. Success NPs wants to create tools and provide support NPs need to thrive in their careers.
So why wait? Check out our Success NP Etsy shop, linked in the show notes, for our digital guides and other digital clinical resources. Hi, Success NP, your host here, Sandra, and today I am joined by Tina Vasant. She is a registered nurse with a BSN from Lincoln Memorial University and an MSN in acute care coordination. She has experience in both progressive and cardiovascular intensive care units, and she's currently working with an insurance company, working with chart review, and occasionally works as a transfer coordinator nurse on the side. I don't know how she has time for all these things. She's also the host of the podcast Good Nurse, Bad Nurse, which explores the realities of nursing through compelling stories and discussions. The podcast covers both the positive and the negative aspects of nursing using real-life scenarios and sometimes involves true crime, dun dun dun, to illustrate these points. Welcome to the podcast, Tina. We're so happy to have you on. Exactly.
Thanks for having me.
Yeah. So let's get started on kind of what you're into these days. The good nurse, bad nurse. You're blending the true crime with nursing ethics. What inspired you to start this podcast, and how has it been evolving over time?
Well, so way back then, it feels like forever ago, it was 2018. I had been a nurse for about 3 years at the time. I remember I had reached a point that I was feeling very confident in my nursing, and I had turned a corner where I was actually enjoying nursing. I remember just kind of having this epiphany moment, just like, wow, because when I first started, I was horrified. I was just like, what have I done to myself? I put myself through this awful, terrifying experience called nursing school. And then now I really wasn't sure if it was what I wanted to do. I wasn't sure if I liked it. I didn't know if I was any good at it.
Were you in the ICU? Or you were just like med-surg?
I started out on PCU. I actually started out on a cardiac step down floor, and I was only there for a couple of months. It was just not good there. And then I transferred to a level 1 trauma center on their PCU. Still quite overwhelming, and I just felt overwhelmed for probably about a year. And then maybe 2 years in, about a year later, I was feeling okay. And then probably 2 to 3 years in was when I really started to feel like I'm actually enjoying this. It's not like it happened overnight. I just realized it one day. I was looking forward to going to work as opposed to dreading it and like crying on my way home, or like thinking about everything I did. Did I do everything correctly? Did I, do something to hurt someone? Did I miss something? And it was just all of that stuff, that self-doubt that creeps in, that imposter syndrome that everyone goes through or seems to go through. And so when I discovered podcasting, I was listening to lots of podcasts, and I thought I would love to have a place to just like talk about my experience and let other people know that when you feel that way at the beginning, that's okay. You can feel that way, and you will get through it. You will get through that time. It's different for everyone. Not everyone feels that way. There are people I know that just are very confident in themselves, and for whatever reason, they don't experience that. That's okay too. I think the vast majority of people go through it though, and have that period of time that's probably different for everyone, where you feel so unsure of yourself. And I wanted to just talk about it. And I found that when I did start it, I started hearing from people saying things like, "Oh, thank you so much for talking about this. It makes me feel so good. I'm a new nurse and I'm scared to death." And I thought I was the only one that felt this way. And I'm just like, "Oh, okay. That's why I did this. This is good."
Yeah. Yeah. This is the purpose. And so you start off kind of talking about your experience, and then you change it to this true crime. Let's break down what's happening with the good and the bad in nursing, and talking and creating stories around this. When did that kind of start? And then how did you really start to kind of grow momentum with that? Because that's a different beast in and of itself.
It really is. And when I first started, I actually started doing that from the beginning. I sat down and thought about what I wanted to talk about. At the time, I liked listening to true crime podcasts. I kind of have grown out of that now at this point, for my just as a personal preference.
Yeah.
But at the time, I was listening to a lot of true crime podcasts. I think I realized it was kind of like causing some mental health issues for myself. And I realized
Oh,
that's probably
can be
not
kind
the
of dark.
smartest
Yeah.
thing. You're smart.
Yeah.
Yeah,
Yeah. Yeah.
to be listening to that stuff all the time. So
Yeah.
I had to back away from that. But because at the time I wanted a way to, could I incorporate this somehow, like nursing, and I start looking at, these stories online, and realized, wow, there are actually a lot of stories out there about not just nurses, but other healthcare professionals who, there are bad people out there and they get into
Mhm.
healthcare, unfortunately. So I was just like,
Yeah.
this could be a good thing to use these stories as a way to highlight the good and the bad. And
Yeah.
I
And
am
educate. Right.
educate people about
Yeah.
the types of people who you could be working right alongside in a hospital, the importance of advocating for all patients on your floor, not just yours, the ones that you're assigned for. Because if you see someone, a colleague or coworker, doing something that is questionable, the importance of speaking up and advocating for all of those people. Those are human beings at the end of the day. They're not just like, oh, it's not my patient, not my problem. No, it's a human being. It is your problem if you suspect something is going on. And I was like, wow, I could definitely use this to advocate for people.
Yeah, because when I was listening to your podcast, I was finding that from the patient perspective too, I was kind of thinking, like, patients need to know that you've got these people in here, because
Yeah.
you'll be feeling a certain way and you won't be validated, because the system won't really like let you believe, like, no, this can't be going on. No, there's no way. And then you start to realize, like, then one episode with one of the PAs that came on, and he was talking about like providers and how they have this authority over you, and how you think they always have your best interest, and they must. And most of us do, right? It's the rare zebra that doesn't. But when you encounter a zebra, you need to know, like, oh no, this is not a normal situation. And I just thought it was very informational from so many different perspectives, not just from the nurse perspective, or even during that episode, the provider that you had on that was kind of describing that, his perspective on the stories that you guys were sharing about providers that were abusing their authority and hurting people for money, when the guy had like a Lamborghini or some Maserati or something like that. And it was just kind of like, what is going on? That's so scary. You don't think it's happening until you hear it happening. How has your perspective on the profession changed through the stories that you've been sharing and you researched for the show? Because I feel like it'd be kind of hard, kind of like what you said. I'm listening to this stuff all the time. Like, it kind of is super dark for your soul. Was it hard to keep perspective? And maybe that's what led you away from the bedside. And I thought maybe to ask that question, like, where has this taken you in your own journey with nursing through this side of storytelling?
Well, fortunately, I did. I am a end on a good note kind of person anyway. I do like to keep things positive, even though I'm also a realist. So I want to keep things real. So I do balance it out with the good nurse story. So for every horrible story that I read about or talk about, there's always a good one to end in on. And so those are endless. And the good thing is, when I do the research looking for these stories, the good the quote good nurse stories are the stories about, people doing amazing things out there, helping people, sometimes just like great, nurses or healthcare professionals living their life and out in the world, and then something happens, or sometimes things that they do while they're at work, sometimes creating entire jobs that in order to advocate for a cause or a certain group of people. Just so many things. Those are just endless and they're ongoing all the time.
True.
And so these other stories, while yes, there are a lot of them, plenty of them, because I've been doing this since 2018, and unfortunately, these people are not apparently listening to me because I keep telling them, you're going to get caught if you do this stuff. Those are out there and they are ongoing as well, but they're far outnumbered by all of the amazing, wonderful things. So I think that's helped keep my perspective in the right place as far as just the quality of the people in healthcare. I do think the vast majority of people that go into healthcare do it for the right reasons and are there to help and advocate for people.
Yeah. And I think too, what you're echoing and you're kind of confirming is that there's a reason why nursing is the most trusted profession, right? Like we're the most trusted profession in, when they compare us against anyone, we just beat out, right? Like you trust your nurse and there are going to be hundreds and thousands of more stories of a nurse looking out for you than a nurse taking advantage of you. So I think that's a really great perspective because that's the truth, right? Just like you're saying, I'm a realist. The truth is the stories that you describe are very, very, very rare, but that we need to, it's still interesting to talk about, dissect, even keep our eye out, awareness for when we're in practice. Even as nurse practitioners, we do see people, and I've seen it in my practice that you just think like, how did he do that? Why did that doctor just, make that call? That was not the right call. That's not the call the other doctors would have made. And you just wonder like, where is this doctor at? What is he trying to do? And again, when you work in a private setting, that's different than, a hospital setting. It's not as money driven as when you're trying to like generate your own revenue with a private practice, but it's definitely something to think about. So one of the things I kind of want to shift to is kind of a nurse practitioner focus, right? Because that's what our podcast here is mostly about. How do you find that the portrayal of nurses and NPs in the media affect, especially in regards to true crime, affect public's perception? So like we said, the most trusted profession, but do you feel like there's a shift or a change at all?
Well, I think that, media in general is just more accessible, obviously, these days. This past, 10 years or so, it's everywhere. And so that's affected lots of areas of our lives. Nursing is no different. I think it's just shown a light on things that are the reality of what goes on. And that's not a bad thing. I don't think that's a bad thing. I do think that there's some media that it can be frustrating for us as nurses and nurse practitioners both, because there are stereotypes that play into the way we're treated when we're working or, we're doing our jobs, that we are somehow the handmaidens for physicians, or that, we're supposed to be, we're seen as sex objects, while we're doing our jobs. We're in our workplace and we're trying to do our jobs, taking care of people. And we're, you walk into a room and even family members sometimes, and I know they probably mean well, but saying things like, oh, you have a pretty nurse, or, just making little comments like that. And you just want to just be like, you can't just stop and educate every single person every time they say something like that, because unfortunately it's pretty prevalent. And I do think media plays a role in that. I also think that media has done a pretty good job lately. I think it's gotten better. There are some, cases of, we were talking before the show, Virgin River. When I started watching that, I did not even realize it was about a nurse practitioner. And I started watching it, and that one, like first episode or so, where the physician, like she's supposed to be coming to help in that physician's office. And there's this, pushback from the physician. It was just like, wait, what? Are you kidding me? I was so excited. And I just got hooked into that. I was so happy that there was a show that was really showing what a nurse practitioner does, their role, the importance, the autonomy. Oh man, I loved that. I think Paul the Midwife. Oh my goodness. That is just an amazing show.
Yes.
Yeah, it is.
No, it's beautiful.
It is beautiful. And it just shows what midwives do. It's, again, the autonomy, how much they advocate for their patients. Also, Nurse Jackie, and I know that's a little bit controversial with some people. I loved that show. I thought it was very raw, but it did show like the action that goes on in an emergency department with the nurses and what they're doing and the things that they're doing hands on.
Yeah, I agree.
To take care of patients. Scrubs is a good one. Meet the
Yeah.
Parents. I love the movie Meet the Parents because it is a movie where
That's right. He's a nurse.
Ben Stiller's character is a nurse, and I love that Robert De Niro, the dad of his fiance, just couldn't stand that he was a nurse. Like, why didn't you go to medical school?
Locker. Yeah.
That conversation is amazing. It's amazing that such a popular movie had this conversation about. And he said, I didn't want to. He even got into medical school. He, did great on the MCAT, and and I can't remember what the reason he wanted to be, because, and that's what I think people think you go into nursing because you didn't want to have to go, spend 10 years in becoming a doctor. And no, nursing is a different profession. Even a nurse practitioner it's diagnosing, it's prescribing, it's treating, but it's still it's a level of nursing. It's like the complete picture of nursing. And
no, I love when they ask you as a nurse practitioner, oh, so you're a nurse practitioner, are you going to go to medical school at some point? It's like,
you're just like,
no,
I did. Thank you.
No. This is where we stop.
I've completed, my, and I know there are doctorate programs, but you're working at the highest level of your profession. And so I love seeing examples, in the media where they're actually portraying it accurately. I love it. So,
I do too.
Of course, there's plenty of shows. I mean, I could list the obvious Grey's Anatomy. And
I just feel like, those are such melodramas that they take so away from the medicine part.
Accurate,
They're not. But I felt like The Pit. I recently watched an episode of The Pit, and it was pretty like raw, and I felt like it was very accurate to the roles of. They don't really have nurse practitioners on there, which that sucks.
Maybe they will.
But maybe they will. But I just kind of felt like, I don't know, the nurse and the physician dynamic when I worked in the ER, I felt like that was very accurately portrayed, and the drama, the crime issues that are in that too. I mean, because some people come on drugs and there's ethical issues that they feel like we don't want to treat them, or people that aren't vaccinated.
Oh, I love that.
Different concepts were so well portrayed, I thought, and very accurately portrayed the frustrations that healthcare providers have. I thought it was very good.
Nice.
So, in your experience and the stories you've covered, what unique ethical dilemmas do NPs face that might differ from those of the RN, from your experience, that you've been able to pull up and go, yeah, this is a nurse practitioner solo issue that RNs really don't have?
Well, obviously RNs do not prescribe medications. And one thing that I will tell you from doing the podcast is that nurse practitioners, any of you that are listening, I say this all the time on my podcast, you have got to be careful about prescribing controlled substances, because you have a target on your back. And I've done stories about nurse practitioners who have done it intentionally. Unfortunately, those people exist. You're going to always find people who are out to make a buck, and so yes, they're working in quote pill mills or whatever you call them. But I have also done stories that will horrify you, make the hairs on the back of your neck stand up. About one in particular I'm thinking of is a nurse practitioner who's working in a legitimate pain clinic that is trying to help people with chronic pain, doing everything right. She was doing everything right. And they literally came barging in, guns aimed, ripped her documentation off the wall of her nurse practitioner license and everything, and was like, get on the ground. And she went through so much. It took, I don't remember now the details. It's been a couple of years since the story, but went through so much to prove it. But she was able to prove that she did everything accurately. But when the federal government gets their sights on you, and you really get into a lot of trouble once they are looking at you because they suspect that you are overprescribing medication.
Yes.
They could get you in a lot of trouble. And even if you're doing everything right, you're going to have, you're going to go through a lot to try to clear your name. And this person was able to do that. And I'm not trying to scare you at this, but at the same time, it's a reality. It is just a reality. So,
you know what? And I'm going to kind of stir the pot here, because I think it's kind of interesting for nurse practitioners when we get that, it's such a balance for us to get that prescribed substance, controlled substance, legality approval. It's always a big state issue. Should we give them a limited scope? I mean, all these different things. You know what's I find very interesting? Physicians were the ones prescribing this stuff the whole time, creating the problem, right? Like, I feel like doctors created the problem. Now there's a big hubbub about giving nurse practitioners the access to these drugs. And what I find very interesting is they don't really acknowledge the fact that I'm like, we didn't have it and y'all created the problem. Now you're worried about us getting access to these drugs. And by the way, I was a nurse on the floor and I saw what was happening with the narcotic thing. And it was very uncomfortable for me to administer these drugs as a nurse to patients that were completely not in pain, sitting on the phone, talking. And I was told, the pain is where the patient says it is. No matter what they say, you give the drugs. You don't ask any questions. And that was coming from the top, right? I don't know if you remember that, but I remember that as a baby nurse.
Pain
and
is,
I remember
the
being
vital sign or whatever they.
Yes, it was the fifth vital sign. And if you're in pain, I could not question. And I would come out and just be like, this guy's in there sleeping. He woke me up. He called me out of a dead sleep to come in and bring more pain medicine. Like, that does not feel like good care. Like, this is a psychosocial thing. There's something going on psychologically with this guy. He's depressed, whatever. And it wasn't that I didn't want to take care of the patient. That wasn't it. But I knew that something else was going on. And so I just find it very interesting that this is the hill that some people die on with nurse practitioners. And I'm like, we didn't cause the problem. Like, in fact, most of us, and personally, I can speak for myself, I don't want access to controlled substances. So I could apply for a DEA with my current job. They're, of course, pushing me like, please, please, please. And I actually refuse because of the ethical issues I saw as a nurse. I don't even want to have the ability to prescribe them because I saw how much of a mess it was. And, you said something earlier about Nurse Jackie, but if from a true crime perspective, nurses do get addicted to these things. Like, and I like that they showed that aspect in that show because a lot of nurses do struggle with, taking substances from patients. And I remember, in the Florida bylaws, like, you're able to fail after trying to get off the drugs. They will still give you your license. And I found that very interesting because I thought, then this really must be a problem. Like, if they're even going to allow you to kind of relapse and then still try to get your nursing license after it. So I just feel like the problem is very complex. I think that there is also like a huge, psych mental health problem associated with this,
No doubt.
that we are not just medicating patients' pain. We are medicating, an emotional or spiritual, whatever you believe in, pain in these settings. And I don't think nurse practitioners are the problem because we've had that problem way before we ever even got the rights to prescribe them. And in fact, you might find that NPs like me are a little more like, I don't know. I think I'm going to need to take a Tylenol, take an ibuprofen, and, and have a little bit of more of that regulation. Not that we don't believe what the patients are saying, but that we know what can happen when you take these drugs. There are side effects from, addiction with these medications.
Oh, yeah.
So,
There are plenty of stories out there about physicians doing the exact same things, about physicians getting, their clinic shut down, arrested, charged. So it's not, that's the way a lot of these stories go. Like, you can find stories about nurse practitioners misdiagnosing something, missing a diagnosis or just diagnosing something completely wrong, and someone dies as a result. There are stories like that. They've been arrested because of it,
wow.
neglect for some reason, overlooking something, or whatever the reason is. But for all of those, you can also find plenty of physicians doing the same thing. And I think that it's easy to just like pluck those stories out and pick on nurse practitioners and just say, see, we've given them too much, we've expanded their scope to the point that no, it's because anything that you can say about a nurse practitioner, whether they, you can find examples of nurse practitioners who, just aren't good at their job. They're just not, for whatever reason. I've worked with some that are just, you can just tell, like, they're just, they don't care about the patient. They're overwhelmed, whatever. You can also find plenty of examples of physicians that are in the exact same boat. It is not about whether they are a nurse practitioner or a PA versus a physician, and a medical doctor or a DO. It is not about that. It is about how much effort they've put into their own knowledge base, their skill level.
Craft. Yeah.
Yes. How much education do you have? How much experience? How much mentorship have you had? How much guidance? And I've worked with nurse practitioners that, in the CVICU that I would much prefer having them taking care of my patients, as far as like understanding the disease process that's going on.
Yeah. The pathophysiology, pharmacology,
yes,
whichever. Yeah.
exactly. And then versus, some physicians where you're just like, well, I know they may understand it or they may not. Some of them, they're just like, you can just be like, oh my goodness, we're going to struggle to get through these 12 hours.
Yeah. As my dad says, not every doctor made straight A's.
And it's true. And that is so true. I've said that too. Somebody had to graduate at the bottom of their class.
Somebody graduated. Yeah. Well, I think that's just something else I wanted to talk about. I thought that was very interesting. And I really appreciate you bringing that up, because I think, again, like having those, just realizing that it can happen to anyone, just say that nurse practitioner did everything right. Like, why did this happen? And just kind of being on guard for those things. Have you ever noticed any recurring themes or red flags in a bad nurse story that a nurse practitioner should be aware of? Anything that you've noticed, that you're like, this is a common thread. I'm starting to see this.
I mean, I guess that's probably the one that I would talk about the most, is just the overprescribing and just kind of that awareness. Also, being aware of the fact that if you are in a state where you do have to have, a provider, a physician over, that's sort of like looking over your charts, not all states give nurse practitioners that full practice authority. And so being aware that where you fall, in that, if you have someone that you're relying on to look at your charts and kind of like be that person that's helping you make decisions or whatever, just not just like taking that for granted and just that they're doing that. Because in one case in particular that I can think of, that doctor kind of just threw them under the bus. So just being aware of that relationship. I wish all states just would give full practice authority. I think that people are just afraid of it, and I think we've hinted at some of the reasons why, and it's rooted in ignorance, really. But we just have to do a better job of educating people.
When you were talking, you made me think about the nurse that in California that had been calling herself doctor and been, she was a doctorally prepared nurse practitioner, but it did not matter in her state. She was not supposed to be referring to herself as a doctor.
Yes,
and she ended up, she ended up losing her ability to make, practice in that state. She was going to get sued. It was kind of a mess. And I remember, thinking the rules aren't the same everywhere. And, you have to make sure in each of your states you can refer to yourself this way. But I just feel like it's one of those crimes that I don't really think is a crime. Like, I'm so sorry. I'm just having a hard time wrapping my mind around a nurse practitioner that's doctorally prepared, that spent the extra time. She's not referring to herself as anything inappropriate, but this is just going back to some type of scope breach, battleground. You're misrepresenting yourself. And I don't think there's anything wrong with saying, I'm Dr. Pryor, I am a nurse practitioner, I'm going to be seeing you today. I don't think there's anything wrong with that. I don't typically do that, but there's nothing innately wrong with what I just said. That is an accurate statement. And I just feel like it's just one of those things where it's like, why are we battling over this when we actually have bigger problems? Like, we don't have enough providers. Patients are waiting longer and longer to see someone to write medications or just hear what it is that they're going, dealing with. And so I just feel like it's a really bad hill to die on, especially as more professions are creating these doctoral programs from, physical therapy, pharmacology, like all these programs are coming out with doctoral degrees, which I think is just great. It's just more education. People are spending longer learning, but it just seems so strange to me that there's only one person in the whole hospital, one degree in the whole hospital that can call themselves doctor. And so I just find it interesting that nurse practitioners are having to pay attention to their individual state laws before they can refer to the extra education that they got
Yeah,
with confidence. And I hate that for us.
I
Like,
do too.
why make us feel more uncomfortable when it's already tough to be an NP? We're not physicians, we're not nurses, we're in this middle ground. And yet it's like, nope, can't do that. Nope, can't prescribe. Nope, can't work alone. Nope, 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 nope. And then it's like, we don't have enough providers.
But we need
How do we
you,
solve the
and we'll
problem?
put you in an emergency room all by yourself with no physician whatsoever.
No training, just go do it.
Yeah.
Just figure it out.
Throw you in there. Yeah.
Throw you in there, but don't you dare do these things. And it's
Mhm.
like, these things aren't the problem. Like,
Yes.
these things are just minor issues when we
Yeah.
actually have major problems. And we may actually be the ones to help fix this or to bring a different perspective that
Yes.
could actually kind of create a different environment around this. Like, why this? I don't know. What do you think?
I
Is that too
agree.
much?
Why are we focusing on why? But it is you nailed it though. It's all about ego. It's all about that worrying about scope creep. Worrying that they're honing in on they're coming in on my territory. I think a lot of there are. I know that there are people who go into medicine because of the prestige that goes along with, just being called a doctor, being called a physician. And I know not everyone is like that. I know so many amazing physicians. So not everyone
Yes.
has that. And
Yeah,
I would
yeah.
say most
This is
people
not a
don't.
blanket. Yeah.
Actually,
No,
yeah,
yeah.
most people that I work with don't act like that. But
Yeah.
occasionally you come across those people, and and a lot of them have a lot of power. They so, and I do hope though that this problem is aging out. I think that maybe some of the people that are kind of in the younger generations don't have that mindset as much, So I think that some of the residents that I worked alongside when I worked at 11 Trauma Center, they seem to just have a much higher respect for bedside nurses and also nurse practitioners. And I, working as a transfer coordinator, I listen. That's literally my job, is to connect providers and let them talk. And I literally sit there and listen to everything that they say and document what they say. And so I think that most physicians have a high respect for nurse practitioners, and they talk to them like, their colleagues. They're
Like
not
colleagues. Yeah.
disrespectful. Absolutely.
Yeah.
It's
I would agree.
it's horrible when it doesn't happen that way, but I definitely
Yeah.
think that most people are definitely very respectful.
Yeah, I would agree. And unfortunately, like you said, the people that have the most pull or some of the most, the highest
Politically.
authority tend to have that mindset. And so it's unfortunate, but I think it's important. I think the younger generations are more focused in on work-life balance. A lot of the physicians are more focused in on, I can't do it all. And they're liking the fact that an NP will take a level of that off of them, and that they can focus just on one thing. And then they realize when they get back, or whenever that NP is gone and they have to go back and do that grunt work, they're like, oh, she's vital for me to get this part done of my practice, so I don't have to do as much of that. And,
Absolutely.
each of us have our roles, and there's more than enough work to go around. And I think the younger generations are seeing that. It's like, no, if you get a nurse practitioner or a PA on your side, that just only extends what you're able to do. You're, by collaborating with one of those providers, you are, especially when you train them well, you have a hungry NP, you really spend some time training her. That's just an extension of your brain. That's all that you just did. And it's just such a beautiful, when I've seen those relationships with a physician and a nurse practitioner, it's such a beautiful collaboration and, synergism that they're all working off of like, yeah, no, we're working together to get to the same thing. And yeah, I think that's really good. Any nurse stories on your show that have impacted you and how you view your role in healthcare? You've got to, tell me something like, hey, Sandra, like this one really stuck out to me. This one was really beautiful, because you see enough of the, the bad ones. What's one that stuck with you that just makes you feel warm and fuzzy inside?
So as far as unfortunately, some of the good nurse stories aren't necessarily happy ones. So, and
Yeah,
some of the
we all love the smudge, right? We like that. Yeah.
well, some of them are just like they're heroes for a reason. Maybe they,
Yeah.
died in the process of trying to help
Oh
someone,
my
or
gosh.
so some of those are, and so I try to end the show on a
Whoa.
good note, and yet at the same time, I'm just like, boy, I've just depressed myself because I've had two really depressing stories, but I wanted to highlight, the amazing
Yes.
thing that the nurse did, and one of them that is just like, I'll never forget it, is the story of a nurse. Her name was Tristan Kate Smith, and and I don't know if you need to do a trigger warning or whatever, but she took
Yeah,
her
yeah, yeah.
life, and she was young. She was in her 20s, young nurse, and she was an ER nurse, and she took her life. But before she did, at some point, she had written a letter to her abuser, and it was to the hospital. Oh my goodness, it will just it just absolutely gutted me. And after that happened, and her father found on her laptop this letter that she had written to her abuser, it was so just beautiful. It's it was just so raw and so real, and you could just see the damage that it had done to her. And I really wondered at the time. I remember just thinking there was a whole that her father has just worked tirelessly ever since that happened to bring awareness to staffing ratios. He's gone around. I actually went up to Columbus, Ohio, where because she was in the state of Ohio, so they're trying to get laws passed to
Wow.
regulate staffing ratios
Yeah.
in her using her memory, using her story. And so I actually went up there and I spoke at a rally there at the Capitol where they were supposed to be voting
I
on this.
saw that you were involved in that. Yeah.
And so
Yeah, I saw you on the podium.
I talked about her as a good nurse for one of my episodes, and because she is, look at what she's done, posthumously. She look at what her father is doing in her name, and even though
Yeah.
it's very painful and difficult to talk about, it's also very important to talk about, because for even though her story has gotten a lot of media attention and it's very high profile and lots of people are talking about it, there are so many people that have succumbed to mental health issues, and it
Mhm.
stemmed from all of the stress of working bedside, of work, and just feeling inadequate. That feeling when you leave work at the end of the day and you feel like you just didn't do enough to help your patients, you feel inadequate. And really, what's at the root of that problem? What's at the root cause? If you really go back and look at it, it's because there were just not enough resources for you to
Yeah. The
really
system is
properly.
failing.
The
Yeah, no,
system
the
is
system
failing
is the
so
problem.
many
It's not the
people.
individuals. Yeah.
Yeah. So even though it's not a necessarily warm and fuzzy story, it's definitely, probably of all the good nurse stories I've done, it's definitely the one that's just like stuck
The
with me
most
the most.
yeah.
Yeah.
Yeah. That's just really like raw and real, and I think it's emblematic of the systemic issues that we have in nursing, and it's why people are leaving nursing and going into the nurse practitioner role hoping to get away from a level of that, only finding as a nurse practitioner there are their own mountains that you have to climb. They're their own, issues that you're having to navigate in your career. One of the things I was thinking while you were talking, you've had 3 million downloads of your podcast. I mean, you're doing phenomenal. It's incredible work. But you've also had on, I feel like either you, one of the, I think it was another podcaster recently had on Redonda Vaught.
Mm-hmm.
What was her, is that her name? Is that her? Redonda, I think it
Redonda
is.
Vaught is her name. Yeah.
Yeah.
Mm-hmm.
And she was a nurse that, had the homicide issue with,
Mm-hmm.
she had, and I actually had a conversation with her as well. And I was so interested to hear the system failures that were going on with her job and how she's on the chopping block, right? I think they denied her license back, right? I believe that she was not allowed to get her license back again. And yeah, I just found it very interesting that, again, here's another system problem. She was able to override the computer. She made, something happened, and they're not bad people. This is not a bad person. This is a system, either overstaffed, distracted. It's a lot of different things that end up causing these tragic events. But again, I do think it's good that you focus in on, what she sacrificed by sharing what it was that she was going through on the floor as a nurse. And so many nurses feel that way. A lot of nurse practitioners struggle and, you go from being a nurse crying in your car to being an NP crying in your car. The only difference is that you're $250,000 more in debt as the NP than when you are the nurse.
Oh.
So there's that same balance, that same issues that you're noticing, I've noticed in both roles. And I think, doing our best to change the system really is the focus, and then doing our part to focus in on what we can do that day. And that's the most that we can do. And we got to let the rest of it go, is something for both the nurse practitioner and the NP. Like, we can only do what we can do in that space. The system is broken, and find your way in that system is the best thing that you can do for yourself. And I think, I think that's good advice for the nurse and the NP for sure.
Absolutely.
And if you had to find and describe the perfect good nurse and maybe the bad nurse, what would you say? How would you describe them? How would you give that definition whenever you're telling your podcast stories? This is the good nurse and this is the bad nurse. How do you make those definitions?
Yeah. So what I always tell people, there's certain things, I was a preceptor also and trained people. So there's certain things, making good habits, certain things there are things that you will have to sacrifice. You cannot, and this is one of the things I talked about with the Redonda Vaught story. You cannot follow every policy to the letter, because the hospitals are going to put all these policies in place to cover their butt when something goes wrong, and then come back to you and say, well, but wait, the policy is this, this, and this, and you did that. And the fact of the matter is that if you followed every single one of those policies, you would never be able to take care of the patient. You would be, stuck in the minutia of all of these different steps, trying to get yourself to where you're actually taking care of your patient. And so you have to pick and choose the things that you're going to go, I'm not doing that one. But when it comes to safety, you cannot.
I was going to say safety is one you just
Safety
can't.
is just something you just can't. You've got to do those rights. You've got to check those 5 rights. You've got to check the armband. You've got to, monitor your
You can't
patient.
override the system. You can't tell it pull the drug out anyway. Well, you can't do those things.
Actually, Sandra, you have to do that if you're working in an ICU. And this is something that I think a lot of people don't understand, is that I remember when I worked in PCU, my preceptor, she was so good, and she taught me not to don't ever hit override. You can't hit override. Well, when I transferred to ICU, I still had that mindset, and they were just all like, you're going to have to get over that. And yeah, you really do, because as an ICU nurse, you do have a lot more autonomy. You are allowed, and it is actually written in the policy, that there is a level in which you can make decisions that is reasonable if you feel like your patient's life is in danger, knowing that you're also at the same time going to be getting in touch with the provider. And so you kind of an understanding, there's very gray lines here. So you have a patient who is not on a pressor, but you're in an ICU for a reason. All of a sudden their blood pressure starts to drop. Are you going to seriously go, I'm not going to go
wait for pharmacy?
There is pharmacy has not seen it. A doctor has not, or a nurse practitioner or a PA has not put in an order for it yet. No, you're going to go get the Levo, pull it out, come in while you're hanging it. Call Sandra NP and tell her I'm hanging this Levo now, and put the order in. And so you're all of these things are happening at the same time. If you didn't do that, people would die, and that's just a reality in an ICU and in an ER. And I think it probably happens more in an ICU than it does in an ER, because in an ER, I feel like the physicians and nurse practitioners they're right there.
Yeah, they're all working together in tandem. But in the ICU, the doctor's someplace else. Yeah, you're right.
Somewhere else. And so you really do have to make those decisions. It doesn't happen all the time, but it happens enough that it's just a reality of life that, yes, you will be hitting override a lot. And that's scary. And that's one thing that it was literally a reason why I chose to leave the bedside, because
I was hoping you were going to talk about that.
Yeah, I mean, I did. I chose to leave the bedside because when Redonda was arrested, I saw that story and I was just like, wait, what? And I just knew that there had to be something that she did wrong, that there was some egregious mistake that was just unforgivable, and I went and read the whole CMS report that literally just step by step told everything that she did. And I was just like, she made a mistake. She made several mistakes that are probably because of the culture in which she was working. And that's the problem. So in a just culture, in that situation, what should have happened is this horrible thing happened and a patient died because of it. And now we need to go back and look at this and figure out, what do we need to change in our processes that can keep this from happening again?
100% agree. Not
Arresting her.
punish. Yeah, exactly. This is how I feel as well.
And then so
Yeah.
she's arrested, and I immediately drove to Nashville to be there for the hearing. And I just could not believe that not only did, she did everything right in terms of like filling out her incident report, telling everything that happened. Just, I will say,
honest disclosure. She wasn't trying to like hide anything.
She was just being honest. One thing she did wrong that she didn't know, and nobody I think would know, is not asking for an attorney. And if you do something that very obviously leads to a patient's death, please ask for an attorney. She didn't know to do that. I think a lot of people would not know to do that at the time. I wouldn't have known. Do not trust the hospital, and don't talk to their attorney. They're working in their best interest. But, you need to just close your mouth. Obviously, if a patient's life is at stake in that moment, you have to speak up and say whatever you need to say to help the patient. But
yes,
if when all is said and done, and you're kind of like looking at, oh, what just happened, you really do need to close your mouth and ask for an attorney, and then decide how to take next steps, or you could get in serious trouble. Because that's what happened with her. She was just so honest and just trying. And then for some reason, this case came across the desk of an investigator, a TBI investigator, and that TBI investigator decided, okay, I need to look at this, and started doing some investigating. And then, based on some answers that they got from somebody working at a hospital, let's don't name names, but whatever hospital it happened to be, somehow that investigator got the impression that they needed to then present that case to the prosecutor. And the prosecutor took that information and went, yeah, it's a good idea. Let's go arrest this nurse. And that's exactly what happened. And then not only that, but 2 years later, a jury of 12 people, of her peers, convicted her. So that's why I walked away. I was just like, I can't work in this environment. It's too dangerous. We don't have enough staffing. I'm working in a CVICU where I'm handed 3 patients, very, very sick patients, and I'm leaving. As an experienced nurse, I'm leaving crying because I was scared to death. Like, what just happened? And no, I can't work in that environment, knowing that if I make a mistake that leads to someone dying, I could literally be arrested and lose my freedom, be away from my family.
Livelihood. Yeah, no, exactly. Yeah. Wow. Well, I want to end on a positive note, just like you do on your podcast, taking a page out of your own book. So what is maybe a humorous moment from your podcasting on Good Nurse, Bad Nurse that maybe stuck with you, that you're just like, all right, this one's kind of funny. This one's kind of silly. Let's turn this thing around from going to jail. Let's turn it into laughter. What you got for me? Okay.
So I laugh all the time, all the way through even though the dark subject matter, I definitely am a person that laughs at inappropriate times. I am horrible at funerals. You don't want me ever coming to a funeral, because I just, once something strikes me, I would just like start smiling ridiculously.
Yeah.
I'm horrible. I'm just like, oh, please don't. Yeah. It's not funny. Yeah. Nothing's funny. And the more I try to do that, so the
harder you try to stop laughing, the more you're laughing.
Yeah. But one thing that it made me think of is like that I would say the podcasting has connected me with so many just wonderful people. And I went on the Nurse Lake cruise. I guess it's been a little over a year ago now. And while I was there, I met all these amazing people. Like, I just meet people that would just be like, oh, I listen to your podcast. And then, and there's just different nurses, all kinds of other influencers, people that call themselves influencers. And we were just all like, we decided we wanted to do karaoke, and we went we called it kiddie pool karaoke. And we went up to this like area, like the kiddie pool. Funny. There were no children on the Nurse Lake cruise.
No kids, but we're in the kiddie pools.
So we went to the kiddie pool because there was nobody there. And somebody brought like their Beats like speaker, and they started playing. So
portable speaker.
Yes, portable speaker. We would pull up music on that, and then we literally stood there and played and did karaoke, and it was so much fun, man. That was like the most fun cruise ever.
So yes, single, like, unfortunately, when you have little ones, it's just like, you can't go on the fun, Nurse Blake cruise, but it sounds like it's definitely worth checking out for when you're in a single space, no kids.
Yes.
Get out there, check it out. That sounds like a good time. Well, Tina, I absolutely love your podcast. I love your conversational style. It's very relaxed. It's such a great show to listen to. So everyone, check out Good Nurse, Bad Nurse, wherever you get your podcast. We'll link them in the show notes. Where can people find you? Give a shameless plug for what it is that you're growing there.
It really is just Good Nurse, Bad Nurse. I mean, if you look up Good Nurse, Bad Nurse, it's pretty much just me. Nobody else is going to call them crazy enough to call themselves that. So, yeah, you'll find me if you just Google Good Nurse, Bad Nurse, or look it up on any of the social media platforms or wherever you get, like you said, get your podcast.
Yeah. And we do a rapid fire at the end. Are you ready, Tina, for rapid fire?
Probably not.
Can you? Okay. Yeah, you're not. Let's just go for it anyway. So tell me, what is your favorite color?
Blue.
Oh, that was quick. That was super quick. Are you like a solid navy blue? Are you like a royal blue? Are you like
all colors of blue? Yeah,
any
probably
blue?
Lighter. Yeah.
Okay. A lighter blue. Okay. And then favorite dessert. If you have to pick a dessert, no matter where you are at least trying it, because you just love this thing so much. What is it?
Banana pudding.
Banana pudding.
I'm from the South. Yeah.
Yeah. I think I saw Tennessee, right?
Yes.
Yeah. And then, okay. So because this is the Success NP podcast, I want to know, how do you find Tina? How does Tina define success for your life? This is not a rapid fire. This is a little bit deeper, but I think it's important to hear how you in your career, in your life, are chasing success or chasing that thing.
That's a great question. I think that for me, and I've had lots of different roles as a nurse, and just I'm constantly evolving and challenging myself. So I feel like as long as I'm being challenged, if I feel challenged in the position that I'm in, I'll stay there. And once I feel like, I'm feeling stagnant, I want to move forward. So then, but whatever I'm doing, I want to get the certifications. When I was on PCU, I got my PCCN. When I moved to ICU, I got my CCRN. I'm just always wanting to just kind of like work at that highest level that I can. And then when I feel like, I'm feeling a little bit, like I got this, I'm ready to move on and challenge myself. So to me, that's success.
Yeah. And I think it goes back to the very first story you told about how you finally kind of got settled as a nurse at like 1-2 year mark. And that's when you decided to launch the podcast. And so I think for any nurse or nurse practitioner that is thinking like, all right, I'm at this place, like I'm feeling like how Tina did, or, whatever that story is for you, to just launch something new, go into something unexpected, because you never know what doors it's going to open. You never know what conversations you're going to be having and what stories you're going to be diving into to share on your next episode. So thank you so much, Tina, for coming on. It was so nice to meet you and to sit here and have this conversation.
Absolutely. Thank you for having me.
Yeah. Guys, thanks for hanging out. Be well. Thanks for tuning in to another episode of Success NP. We hope today's discussion has shed some light on the diverse career options or taught you how to improve your clinical practice as a nurse practitioner.
Remember, whether you're considering a specialization, pursuing advanced certifications, or exploring non-traditional roles, there's a wealth of opportunities out there waiting for you. Be sure to subscribe to the show so you don't miss an episode, and leave us a 5-star review. It helps the podcast grow. The Success NP's podcast is on the World Wide Web, YouTube, Instagram, Facebook, and X. So subscribe to our newsletter for updates on new podcast episodes and other information to help you on your own NP journey. You can always message us at successnpspodcast@gmail.com with any NP podcast episodes or topics you'd like us to discuss.
Until next time, take care. Stay curious and keep advancing your careers as a nurse practitioner. And just a friendly reminder, the information on this podcast is for educational purposes only. The information should not be used in substitute for professional care by a medical provider. The information on this podcast does not represent medical or professional advice or services.
Bye for now.